Let's address something that makes vaccine communication incredibly difficult. The pharmaceutical industry has earned significant distrust, and that justified skepticism gets weaponized to reject valid science. This is a real problem that requires honest discussion, not dismissal. The historical record is damning. The Tuskegee syphilis study, where Black men were deliberately left untreated to study disease progression. Thalidomide causing severe birth defects while companies downplayed risks. The opioid epidemic, where pharmaceutical companies deliberately misled doctors and patients about addiction risks while aggressively marketing drugs they knew were dangerous. Price gouging on essential medications like insulin. These aren't conspiracy theories, these are documented facts. Medical research has genuine conflicts of interest. Pharmaceutical companies fund studies on their own products. Researchers receive consulting fees and speaking honoraria. Regulatory agencies have been subject to industry influence. These structural problems are real and create legitimate grounds for skepticism. Communities of color have additional historical reasons for medical distrust. Beyond Tuskegee, there's a long history of medical exploitation, experimentation without consent, and healthcare discrimination. When public health authorities say, "Trust us," they're asking communities to forget this history, which is neither reasonable nor possible. So how do we navigate this? How do we acknowledge these legitimate grievances while still evaluating scientific evidence about vaccines? It requires some nuance. First, we need to distinguish between critiquing industry practices and rejecting all evidence. Yes, pharmaceutical companies have profit motives. Yes, conflicts of interest exist. But vaccine safety isn't established only by industry-funded research. There are thousands of independent academic studies, government surveillance systems, and international research efforts that confirm vaccine safety. Second, we can acknowledge that regulatory systems are imperfect while recognizing they're still functional. Yes, there's regulatory capture and industry influence. But post-market surveillance systems do detect problems. The myocarditis signal after mRNA vaccines was caught, investigated, and led to updated recommendations. The system worked imperfectly but adequately. Third, we need to separate valid institutional critique from conspiratorial thinking. Saying, "Pharmaceutical companies prioritize profit over health," is a reasonable critique supported by evidence. Saying, "Therefore all vaccine safety data is fabricated and millions of doctors worldwide are part of a conspiracy to harm people," is conspiratorial thinking that doesn't follow logically. Here's a framework for calibrating trust appropriately. When evaluating scientific claims, look at who's making them. Is it only industry sources? Or is there independent academic confirmation? Is the finding supported by research from multiple countries with different healthcare systems and different regulatory frameworks? Do scientists who have no financial ties to pharmaceutical companies reach similar conclusions? For vaccine safety specifically, we have confirming evidence from researchers in dozens of countries, many with nationalized healthcare systems where profit motives differ dramatically from the US system, many with historical skepticism toward American pharmaceutical companies. When Swedish researchers, Japanese researchers, Israeli researchers, and Australian researchers all reach similar conclusions independently, that's far more convincing than industry claims alone. We also need to acknowledge what legitimate reform looks like. Strengthening regulatory independence, requiring data transparency, separating research funding from product sales, addressing pricing abuses, these are real solutions to real problems. But rejecting effective medical interventions because of justified anger at industry practices isn't reform, it's self-harm. The difficult truth is that we can simultaneously hold these thoughts. Pharmaceutical companies have done terrible things and cannot be trusted blindly, and vaccines are safe and effective based on independent evidence. Corporate malfeasance in one area doesn't invalidate scientific findings in another. The opioid crisis was real and devastating, and vaccines prevent millions of deaths. Both things are true. What we need is structural reform that addresses legitimate concerns while preserving access to beneficial interventions. That means stronger regulations, better oversight, elimination of conflicts of interest, and rebuilding institutional trust through transparency and accountability. Rejecting vaccines doesn't solve any of those problems.